I'm Dr. Vanita Rattan. I'm a doctor, but also a cosmetic formulator specifically for skin of colour. So today we have with us Dr. Serum Sehgal, who is a dentist and a cosmetic dentist who's going to be teaching us about root canals. Now, root canals are something I feel like everybody knows someone who's had a root canal, and it's probably one of the more common procedures to happen with age. But it's something I'm terrified about, and doing everything I can to make sure I don't get one of those. But in case, imminently someone does need a root canal or it's something that they have to do, I really want to do a good video to go through what it is, how it happens, why it happens, is there any pain, is it dangerous, are there any side effects? So if that sounds good to you, give me a thumbs up, let's dive right in. So the first question is, what is a root canal?
So a root canal is essentially where we have to take out the nerves in a tooth. So the reason why people need root canals firstly is because there's a large amount of decay which has hit the nerve. It could be an infected tooth, it could be actually a crack in the tooth which has hit the nerve. So essentially the process is we have to clean the nerves out using a series of files and irrigants to essentially wash the nerves out of the tooth.
So you use a file to wash the nerves?
We get tiny little files, we drill, this may sound worse than it actually is. So we use a series of very small files to remove the nerves of the tooth, in the tooth. And then we use a series of files again to shape the canals of the tooth. So different teeth have different number of canals. So like a front tooth will have 1 canal, a back tooth may have 3 canals. So the back teeth are a little bit more complicated to do than a front tooth.
Right.
So essentially it's a series of cleaning and irrigating, making everything really sterile, because that's the source of the infection. The nerve has become infected or some nerve involvement, so we have to remove the nerve.
Okay.
And then we shape the canals to make sure that it can fit a nice filling material. So we shape the canals in a really nice shape, and then we put, it's almost like a rubber cone, a really thin one, and we put it in the canals to make sure that there's no space where bacteria can re-enter. And then we close the tooth up, and then we must, this is really, really important, always doing a root canal, that filing process, it makes a tooth quite weak. So it makes it quite brittle. So always after you have a root canal, you must have a crown afterwards, because doing a crown strengthens the tooth. I've seen it time and time again where patients have root canals, they've got big fillings, the whole tooth is broken.
Wow.
You must have a crown after you've had a root canal because that strengthens the tooth.
Okay. And is it your tooth that goes back in place, or is it a new tooth that's put in there?
It's your own tooth.
Yeah.
It's your own. So a root canal is a way to save your own tooth.
Okay.
The other option is, if you don't want a root canal, you have to have the tooth taken out. It's either one of those 2 options by the time it's got to that stage.
What about an implant? Can you do a root canal and then an implant?
No, it doesn't make sense. I mean, if you were to have an implant, you would take the tooth out and then you put an implant in there.
Okay, and you wouldn't have to file the nerves down?
No, you wouldn't have to do any of that. It's completely separate. So essentially, if you want to save the tooth, your own tooth sits in your jaw and you have a root canal, followed by a crown. Okay. If you don't want to save the tooth and you want to get rid of it, you have the tooth taken out, and now you've got a gap there. Okay. Then that's to replace a missing tooth, so you have an implant. Okay.
Out of the 2, implant versus a root canal to save the tooth, which do you think is the better option?
In terms of an easier option, having a root canal and the crown is probably easier and less expensive. Okay. Having an extraction implant is more the expensive option. Okay. But it depends on what a patient wants to go through, really. Both you need to spend a lot of time in the dental chair. It's not as if one is a really easy option. Obviously, to have tooth taken out rather than a root canal is definitely an easier option. Okay. But to have an implant, that is surgery and that takes a while. Okay. So in terms of if someone were to decide a root canal extraction, of course the easier thing for the patient would be to take it out. Okay. But a root canal is a way that you actually get to save your tooth, and I think especially if it's a front tooth or if it's a premolar tooth, you want to save your own teeth. That's really important. Yeah. So if a root canal is an option, then get one of those done.
Okay, that makes sense. That makes it a lot easier for us to make that decision. Okay, so I'm a complete baby, and honestly, like I even getting my Botox, I'm crying. So you tell me, how painful is this?
Okay, so some patients experience some discomfort, others experience none. So normally a root canal may be split up into 2 appointments, sometimes it's done in 1 appointment. Now, it's a series of removing your nerve. So sometimes that process takes 2 visits. So let's say you remove half a nerve, then the other half of the nerve is still intact. So it may cause discomfort when the anaesthetic's worn off. Okay. But if all the nerve is removed, actually some patients experience no pain at all. Okay. So it depends. A bit of discomfort after any dental work is normal. You need to take painkillers, but it's honestly, if you're numb during the procedure, nothing hurts, by the way. Yeah. Nothing hurts because you're numb and your dentist should give you enough anesthetic so you don't feel anything. Yeah. But just afterwards, there might be a bit of discomfort.
Okay, so it's not the end of the world.
It's not the end of the world.
Yeah. And how do you look after it afterwards?
Just like a normal tooth. Okay. You clean around there with an electric toothbrush, you floss around there just as normal. Okay.
Oh, interesting. So it's not any extra effort like you would with dentures, you said that.
Not at all. Okay. No, it's a tooth, it's your own tooth in there. Then you have a crown on top of it, which I definitely would recommend, and you clean that just as a normal tooth.
And does it look similar to, with the crown on top, does it look similar to the teeth around it now?
So, of course, there's different options in terms of materials of crowns. There are very highly aesthetic options, like a nice porcelain crown, which can look just like your natural tooth, and no one will ever know that you've had any dental work. Obviously there are metal crowns which are cheaper, but then you've got a big silver thing in there. Yeah. So it depends on what option you want to go for, but you can definitely get a really nice looking crown.
Next question is it dangerous at all because it is surgery, or are the risks quite minimal?
So a root canal, I would always recommend doing it with a specialist because it's a very technical procedure and a specialist will receive many years of training for this. It's not as easy as just whacking out a nerve and putting something in there. It's a very technical, and you're working on a tooth which is literally that big. It's a very small technical thing to do. So I would say get it done with a specialist. Mm-hmm. And I would say that they have microscopes and tools which allow a root canal to sometimes be more successful. Okay. So it's not dangerous if done in the right hands. Okay. So I would always recommend seeing the best of the best, because that's just going to guarantee, or it's going to increase the life of the tooth.
Yes.
But no, it's not dangerous at all. There are lots of scaremongering about pushing bacteria into your bloodstream and stuff. No, it doesn't, if done properly.
Fine. And lastly, how long does it last for?
So with all dental treatment, there's risks. Sometimes a root canal can last forever. Sometimes it can last a few years, and unfortunately the tooth gets reinfected even with a root canal in there. But it really does depend. Just always remember to get a crown on top of it, to seal in anything, and keep it really clean, and then just get it checked regularly by your dentist.
Super, thank you so much for answering all my questions.
You're welcome.
I feel like this is something that a lot of us are going to need information on, so that just makes it a lot easier. I think when you hear about it, it does sound really scary, but actually just when you talk it through with an expert, it just makes everything a little bit less scary and more calm. So thank you so much for joining us today.
Thank you.
Make sure you do follow Dr. Serena Sehgal. Please do let us know your account.
So I'm on Instagram at The Foodie Dentist, or on TikTok at Dr. Serena Sehgal.
Amazing. Thank you so much. We'll see you next time.
Thank you.
Take care. Bye.